Hello, my name's Tom Solomon. I'm Professor of Neurology at the University of Liverpool. I want to thank you for clicking on this video link. The common treatment for herpes encephalitis is acyclovir, and in our study, which is called DexEnceph, every patient is going to get acyclovir like they normally do.
Encephalitis is inflammation and swelling of the brain. It's an uncommon condition and you may not have come across a patient with encephalitis before. It's normally caused by a virus, and the most usual virus is herpes simplex virus, which normally causes cold sores, but for reasons we don't understand can also go into the brain and cause inflammation there.
They'll be getting dexamethasone intravenously for 4 days, and we're giving this drug because we think it may reduce swelling in the brain and may improve outcomes. It's a safe drug. Indeed, doctors quite often give dexamethasone for herpes encephalitis anyway, but it's just never been proven, is it really helpful or not? The rest of the treatment for your patients is going to be pretty well standard as normal. So they'll be getting scans, they'll have a lumbar puncture, they'll be followed up. In the study, the primary outcome measure is at 6 months, and we're looking at their neuropsychological outcomes because we know that in herpes encephalitis, neuropsychological outcomes are often the bad ones. People have memory problems, especially with verbal memory, remembering the names of things. And that's what we're going to be assessing in the primary outcome. We've made this study as easy for you to do in your hospital as possible. So it's open label. Once the patient's been randomised, they will just get dexamethasone off the wards in the normal way. Most patients with encephalitis are confused and cannot give consent themselves to go into the study. That's why we will allow their relatives to give consent for them. And this is a pretty standard way of putting patients in a study when they can't give consent for themselves.
The drug normally used to treat encephalitis is acyclovir, which is an antiviral medication that's been used for many years, and we know that acyclovir improves outcome in herpes simplex encephalitis. So at the moment we're running an open label study of dexamethasone in herpes simplex encephalitis. So patients with proven herpes simplex virus encephalitis will be randomised to either receive dexamethasone or to receive the normal standard of care. So both groups will receive acyclovir, but only half will get the added dexamethasone. All the patients in the trial will receive the normal standard of care. They'll all get a lumbar puncture and a brain scan, and they'll all receive acyclovir. And the outcome we're looking at is neuropsychology, and we're looking at that in 6 months after presentation, because we know that neuropsychology is quite often affected in the long term after herpes simplex virus encephalitis. So these patients may get memory problems, which are really disabling for patients after they've had an infection. But I'd ask you to think about the effect that this may have on patient care in the future. We don't know at the moment whether dexamethasone is an effective treatment, and you can do your bit to try and help find out whether that's going to be useful.
The after effects of encephalitis have been very severe on my memory, and this is something we're hoping that dexamethasone may be able to help in the future. I've had to reconstruct my life, particularly in my day-to-day tasks. This is mostly due to my memory problems. The medical profession can only improve the outcome of encephalitis with this type of trial study, and I'm sure that the same amount of care will be given to the patient, whether they're being treated with dexamethasone or not. As a patient, I'm extremely pleased that I was able to take part in various studies about encephalitis, as we're the people that really know and are affected by encephalitis. And I think it's a tremendously positive thing to do once you've survived an illness like this, that we can go on and help other people in the future. As a patient who's made a good recovery, I would ask all doctors and nurses please to think about getting patients and their families to agree to this trial, as it's the only way that we will be able to develop new care plans for patients with encephalitis.
It's really understandable that doctors and nurses are incredibly busy on the wards. If they can take the time to introduce a research study to patients and their relatives, it's often found that the uptake for participation is much improved. We don't expect doctors and nurses on the wards to know everything about a study, but making that initial approach really helps introduce the study. This video is intended as a guide for ward teams to be able to introduce in a very brief way the DexEncephalitis study to patients who are infected with herpes encephalitis.
It's fantastic that your hospital is taking part in this important trial. If you can encourage any of the patients and families that you're working with to think about taking part in this study, be incredibly helpful. Thanks so much.
I know you're busy as doctors and nurses, but I would definitely take the time to look at this study, as a patient, have been involved in many studies before, and I think it's very important